I want to welcome you to the Center for Global Health Equity's second seminar of this year's Distinguished Speaker Series. We're thrilled to welcome Tetiana Skrypchenko from the Rating Group Ukraine, a survey research organization in Kyiv. My name is Emily Trelevin. I'm a research assistant professor here at ISR. For those of you that don't know ISR, we are a social science research unit within the university, including 5 centers spanning the social sciences, along with the world's largest and oldest academic survey research organization and one of the largest data archives globally, ICPSR. The CGHE seminar series are opportunities for U of M scholars and their global collaborators to engage in interdisciplinary dialogue around some of the most critical issues in global health today. And we try to do this in a solutions-focused way. We're grateful to have so many folks in the room from across the university today, including LS&A, social work, public health, Michigan medicine, the International Institute, the Ford School, ISR, and beyond. Thank you for coming. I also want to thank the co-sponsors for today's seminar, the International Policy Center at the Ford School, ISR, and the Weiser Center for Europe and Eurasia, Slavic Languages and Literatures, and the Office of Global Public Health. And I will conclude by introducing my colleague, Bill Axinn, who is facilitating today's panel discussion on Ukrainian children's health and well-being. Dr. Axinn is professor of sociology and public policy here at ISR. I realize I'm pressing some buttons I'm not supposed to. I'm sorry about that. And he's currently the interim director of the International Policy Center at the Ford School. Thanks, Bill.
Thank you. Thanks, everybody. Thank you for joining us. It's really wonderful to be able to work with both Stephanie Chardoul, Director of Survey Research Operations, and Tetiana Skrypchenko, who is the Deputy Director of the Rating Group in Ukraine. I'm going to tell you a bit of an introduction to the pilot study work the three of us have been implementing together in Ukraine and Poland. And then Stephanie will tell you the details. And then we'll let Tetiana tell you about a couple of other studies that are very interesting that the Rating Group has done. I'm going to start out by describing our motivation through our work with the World Mental Health Consortium. The Implementation Training Center for that is directed here by Stephanie Chardoul, and the whole consortium is directed at Harvard by Ron Kessler. We did 2 sets of research that created a set of very consistent findings. One was worldwide global research using the data from the World Mental Health Consortium and all the different countries there that had experienced some kind of armed conflict in the past. It's very well documented that combatants in armed conflict, people who are in the military or fighting, experience mental disorders, mental health issues for years to come. But we looked beyond that to look at people who are civilians and exposed to the armed conflict as civilians. And the first study I have there is this multi-country study from the World Mental Health Consortium. It demonstrates that, yes, civilians are also experience poor mental health after, but particularly points out that children, people who were children during the armed conflict itself, experience increased levels of all types of mental disorders for decades afterwards. The second set of work we did together focuses on the Chitwan Valley family study in Nepal that I direct, that followed whole families through their 6-year armed conflict. It was longer than that in Nepal as a whole, but in Chitwan, our study families were exposed to this for 6 years, and we were able to study the difference between armed conflict violent events that took place nearby your neighborhood versus you yourself experiencing them, all as civilians. That work demonstrates that having armed conflict violence take place nearby where you live increases both major depressive disorder and alcohol use disorder, and does that mainly among people who were 0 to 10 at the time those violent events took place near your neighborhood. Those impacts of violent armed conflict events on people decades later and their mental health, which, by the way, when we say mental disorders, some of you already know this, but I want to make sure everybody gets, these are symptoms so bad that they interfere with your functioning for several days, 2 weeks at a time. And the functioning could be your normal functioning, your social functioning, your cognitive functioning, your emotional functioning, your social relationships, etc. So serious consequences decade later for those who were children. And here we are with armed conflicts going on all over the world, including in Ukraine. We were fortunate to meet Tetiana at the World Association for Public Opinion Research, or WAPOR, meetings in Salzburg in 2023. Based on our respect for all that the rating group and Tetiana had accomplished in Ukraine, Stephanie and I asked them if we could work together. Today, what Stephanie's going to report to you are findings from our first pilot study conducted in March of 2024, both in Ukraine and in Poland, and how we developed some features there that we're now in the process of expanding to a larger scale so we can study the impact of those armed conflict events on Ukrainian children. All yours.
Hi. So I am going to stop here for just a few minutes and describe more about the design of the pilot work that we did this past spring. And as Bill described the motivation for wanting to conduct this work in Ukraine, especially focusing on the well-being of children who are exposed to war and violent events, we mainly designed this first pilot to demonstrate that it's possible to identify caregivers of young children, interview them, and then re-interview them at a later date in the middle of a war. So we did have substantive content, of course, in the survey, but what we really wanted to do was demonstrate that we could be successful in conducting this work. So we defined two separate sample frames. All of the participants were caregivers of children aged 0 to 17. So we screened all participants to make sure that they were caregivers and that they lived in Ukraine prior to the start of the full-scale invasion. We had a sample based in Ukraine, so they still lived in Ukraine, though many of them were internally displaced. So they were living in a region different from where they lived before the invasion. And the second group were caregivers who were refugees in Poland. So they had decided to leave Ukraine with their children because of the invasion. And we chose Poland for this pilot because that is the place where that has the highest number of Ukrainian refugees from this war. So, starting kind of small, just Ukraine and Poland, but we had separate samples in each. And each sample frame had a different method of recruitment. So in Ukraine, Rating Group they have access to software that randomly generates phone numbers from the largest mobile phone providers in Ukraine. And this is called random digit dialing, for those of you who are familiar with this method in survey research. So all numbers have a chance of being selected. When we reach somebody at a phone number, we screened them for eligibility. Are you a caregiver of a child age 0 to 17? And are you willing to participate in our study? So that was the way we recruited respondents in Ukraine. For respondents in Poland, we had a couple different methods. Because we're not able to call internationally easily, one method was we were able to collaborate with the two largest mobile phone providers, and they sent text message invitations to Ukrainian phone numbers that were pinging Polish cell towers. So we had some parameters around the time frame and how often they were pinging those cell towers, but that's how we identified likely Ukrainian refugees because they had Ukrainian phone numbers and they were accessing cell towers in Poland. We also used popular messenger applications and social media sites. So that's how we recruited the respondents in Poland. A little bit different than in Ukraine. As Bill mentioned, the survey was done in March and April of 2024, so very recently. The baseline in March, and then 1 month later, we re-interviewed the respondents from the baseline survey. The Ukrainian sample was done by telephone. So interviewers from Rating Group called the respondents and administered the survey over the phone. The Poland sample was done via an online web-based survey, but the content for both of the surveys was very similar. The content included, as I mentioned, the screen for caregiver eligibility, their location, their region that they lived in, both before the invasion and currently, so we could look at the mobility based on the invasion. We asked questions about their child's educational experience. We asked questions about their assessment of their child's physical and mental health, kind of a general assessment of their well-being, their status before the war and now. We asked about access to medical services for the children. We asked about access to clean water, sufficient food, money for other necessities. We asked where they planned to be in 1 month, and also what their expectation was for where they would be in 1 year. And we then collected at the baseline detailed information for a contact person who would be able to help us find the respondent if we weren't able to reach them at the same mobile phone number. And we got their, willingness to allow us to contact them again in 1 month. And so you can see here the response rates that we achieved for the baseline and the re-interview. A 39% basically baseline response rate for a CADI recruitment of a new sample. Pretty good, especially in a time of war. So we were happy with that. The re-interview rates for both samples was around 50%. And one of the outcomes of this pilot is, that's okay. We ended up with enough cases after the re-interview survey to do some of the, preliminary analyses that we wanted, but we're already thinking ahead to how can we improve that retention rate when we scale this up to a larger project. So this is just showing of the respondents who completed the second survey, the re-interview survey. We asked them kind of hypothetically because we didn't have a firm plan, but if we were to call you in 1 year, would you be willing to do the survey again? And overwhelmingly, respondents who had completed both the baseline and the re-interview survey were very positive about the experience and indicated that they would be willing to talk to us again. So that was a good indicator for us on future success. So I'm going to quickly go through some substantive results. Again, our focus really was on demonstrating the feasibility. Tetiana is going to talk about some other, kind of larger scale research that they've completed in Ukraine that already has had, good results and policy implications. But in this little pilot, so this first slide shows we asked respondents whether their child's physical health was good, was not good, good, very good. And this is showing the proportion of respondents who reported that their child's health was not good. Okay. So for both the Poland sample and the Ukraine sample, consistently, they reported, worse levels of both physical health and mental health after, currently when we interviewed them, as opposed to prior to the war. You can see those counts of not good for both physical and mental went up for both samples. This slide shows the comparison between what the respondent told us about their child's health in the baseline interview for current physical and mental health, and then 1 month later, how they answered those same questions. And interestingly, consistently across both samples, across both physical and mental health, respondents reported a slight improvement in their child's health. And so we didn't have detailed enough questions to really delve into this, but we believe that when the respondents had a first opportunity to report their child's health status, they wanted us to know that their child has suffered both physically and mentally as a result of living through the war. When we went back to them a month later, that report may have been tempered a little bit, but it's important to point out that even those re-interview numbers are, much worse physical and mental health than the respondents reported prior to the start of the war. But that's, kind of an interesting finding that we will look into more. This is looking at, we asked the respondents, how likely it was that they would move within a month, so within a very short time frame. And granted, these are small numbers, but consistently, again, both the Poland respondents and the Ukraine respondents, a higher proportion of them ended up moving in a month than expected to move when we talked to them at the baseline interview. We asked all respondents whether they saw their child's future more connected with life in Ukraine or life abroad. And for the Poland respondents, we asked explicitly life in Poland or life in Ukraine. And for the Poland respondents, you can see many of them were not even able to answer this question. They said, this is too difficult. I have no idea, what the future will bring for my family, which, says something, right? They've been living with all of this uncertainty. But interestingly, at the baseline interview, 36% of the respondents said that they saw their child's future more connected to life in Poland. 1 month later, that number had increased to 44%. So just in the course of a month, they felt more connected to life in Poland than they did the month before. Kind of, flip side, for the respondents living in Ukraine, overwhelmingly, those respondents said they saw their child's future more connected with life in Ukraine. And 1 month later, that was even stronger. So they had, made it through that month. They were still in Ukraine. They saw their child's future more strongly in Ukraine. And this final slide is just a comparison between the two samples. So these are data from the re-interview survey, so the second survey. And you can just see, where these differences are between the two samples. Overwhelmingly, more respondents who are currently living in Ukraine believe the war will end within 2 years. The Poland respondents, not so optimistic about that. The Poland respondents are much more tied to their children affecting their decision on where to live. They made the choice to leave Ukraine with their children, and they feel like their children, caused that decision. Respondents in Poland are more likely to have their children engaged consistently in education. By offline, we mean in person. And then the next one, child did not miss classes. The children in Poland, whether they're in-person classes or online classes, they are able to more consistently attend classes than children in Ukraine, whose education is more interrupted. And then medical services, interestingly, the respondents in Ukraine report that their child is able to more reliably have access to in-person medical help than the respondents who's brought their families to Poland. So some results from this little pilot that we did. So summary, we did prove we are able to identify and interview caregivers both in Ukraine and outside of Ukraine. So great. And we can recontact those respondents who we interviewed. And again, we are hoping to increase our rate of being able to recontact them. We did a little experiment. Sorry, I didn't talk about that. Where half of the respondents, we had a little reach out contact attempt to them halfway between the two surveys. It helped to increase those recontact rates, especially with the respondents living in Poland. So we will integrate more of that into a future study. Most of the respondents said they were happy to be interviewed again, and the respondents were very willing to answer these questions. We had very small amounts of item non-response. Once they started the survey, they, as well as they could, they provided answers. They didn't refuse to answer specific questions within the survey. So we are already working toward designing a larger scale study, also of caregivers of children. We're thinking about what's the most interesting age range of children. We're thinking about, expanding outside of just Poland, thinking about kind of regional migration, Eastern Europe, Western Europe, how are those decisions different? How are those environments having a different impact on the kids' well-being and health? We're looking at methodologically, how can we improve our response rates, our recontact rates with these populations. We are hoping to spread out, so not just 1 month between recontacts, but 6 months, 1 year, 2 years, 3 years, so we really have a better opportunity to measure change. Of course, we have no idea what's going to happen in Ukraine in the future. And, really getting into more detail substantively on how caregivers' decisions about their child's location, their education, their healthcare, how those impact these outcomes, especially these mental health outcomes that Bill highlighted on these young kids. Working. Hello, everyone. First of all, thanks for the invitation. I'm really glad to be here today. I'm really glad that we launched our collaboration, and I also want to remark that in Ukraine we do a lot of research, but there is really small number of longitudinal research. So this one that we started, and we hope to proceed with it. It will be, I would say, the first one during the work and where we study the caregivers and children. So generally, as you already heard from several people, I'm the researcher from Ukraine. My name is Tetiana Skrypchenko. I'm deputy director of Wellbeing group. And we work a lot in the research field with more than 16 years of experience, both quantitative and qualitative data. Also, we start working from the development of questionnaires and ending with policy decision, recommendations and papers. And also we do like different types of research. It also can be focus group discussions as well as combined online experiments, for example, that we started from the beginning of the war. And the war pushed us a little bit on developing our methodologies because we need to reach refugees abroad. We need to collaborate more with online survey, for example. So it was a big challenge, but in some way it even helped us to have larger capacities. But also children, not only our focus, we are doing also the social political research, like about negotiations, about international units and so on. But from the beginning of the war, we are studying children and childhood in general much more than earlier. And since we're talking about the how to guide a policy today, so that's our general experience, our experience and examples. How do we cooperate with different institutions? For example, the main one is the UNICEF, like Child Foundation on UN. We started this collaboration before the war when we had an outbreak of polio in Ukraine in different regions. So they need highly reliable data with good quality and with big samples because they needed to compare different regions in Ukraine. So this focus was on monitoring their child vaccination, monitoring the access to the pediatric help, but also we do different types like mine safety, family well-being in general, street safety, and mental health, what we started just this year. Also work with the World Health Organization monitoring is national waves, but they include partially the childhood breastfeeding, nurturing, people with disabilities and their needs. Also work with UNICEF Poland because since 2022, many Ukrainian refugees, and many of them are with children, found themselves in Poland. So the Polish structure of UNICEF, they are interested more also in child vaccination. For example, they had even experiment that Yale University developed the experiment with interventions. What message, what approach will more persuade the Ukrainian mothers to registrate for the vaccination in Poland? In general, also work for a lot of ministries. For example, Ministry of Youth, Ministry of
healthcare, of education, in cooperation with international institutions who actually pay for this research. For example, Kimonis International about education, or USAID, a lot of different institutions. And today I will show you a little bit, talk about methodology, how do we do research in Ukraine right now, on the example of mental health and the mine safety research that we did this year. It was one of the largest that we did in general in our history, because we surveyed both mothers, fathers, and their children in the case of mine safety awareness. And it was really of a high social importance because it's about the physical health and security of children in different regions. So this survey was conducted by rating group, but we also needed a reliable mine safety awareness and mine safety behavior test. That's why since 2022, we opened our research laboratory called Rating Lab that they develop the criteria, they do the validations, they do the pre-tests. So they develop the test on mine safety awareness and behavior, and this test formed the basis for quantitative survey of children. So how was it working? Like, we had two main goals in this research. Firstly, we wanted to identify what are the factors that contribute into like non-safety behavior. And second, we wanted to compare contaminated regions, different contaminated regions. Like, to give you a small background, like about a quarter of Ukraine are contaminated right now with explosive ordnance. We cannot reach the occupied area, which is here, unfortunately, but we can reach and survey people who live in contaminated area or close to the front line or on the deoccupied territories. So our goal from UNICEF was to compare these just small districts to understand the problem and to give the state emergency service the information where is the biggest problem and the lowest knowledge of mine safety rules. What was the methodology? We used the combined method, both KT, like through telephone survey, just as Stephanie already explained how it works. It was randomly generated numbers. So we surveyed firstly the parents shortly. They had short questionnaire, and also they give their consent for children to participate. On the second stage, we provide those who give their consent. They received individual links for the online survey, and children independently took the online survey. It was better that it was online because it was a bit longer, could be a bit longer. It also was more anonymous. And in the end, we also had verification questions to control the self-completion. So our sample was really big. Again, because of these contaminated areas, we wanted to compare them. So it was almost more than 25,000. Half of them were parents of children from 10 to 70, and half of them actually children from 10 to 70. That actually gives us higher representativeness because we had KT recruitment. It was more probability-based sample, but also we could reach territories that we cannot reach with face-to-face, for example, because it's closer to frontline. We can call them, but we cannot go there with our interviewers. The next, how we decided to build a questionnaire for children, because it is hard to keep the attention of children today when they use the social networks, screening every 5 seconds something. So we did several things. First, to increase the number of those who are completing, we did the reminders both by phone and on messengers. Like Viber, for example, is one of the most used messenger in Ukraine. Also, we did the like some entertainment in the middle of the test. We did the stickers with the famous bomb-sniffing dog who called us like Dog Patron. And he was encouraging children to finish the questionnaire, like saying that you're doing great, let's go further. Like, only one block is left, like, please finish it. Also, after the completing the test, the children, they saw the display of their results, because it's actually the test with right and wrong answers. so they could see their results, what is on the right side, like what is their knowledge of the behavior, and what is their behavior, and what is their knowledge of mine safety rules. So in this case, we also provided some educational function, because in the end, we showed children what actually were right answers and one, and also some from UNICEF, some hints and important rules that they need to remember to be safe on these territories. So like few words about the results. What did we found? That comparing our small districts of these contaminated areas with explosive ordnance, we see that, for example, the occupied territories, they have kind of a more safe perceptions that they are already safe, and as resulting in they have higher level of children who have moderate or high risk taking non-safe behavior, like comparing to those who are still closer to frontline, what is really problem for them. And also we pinpoint some regions where state emergency service need to work more, because it's more than 50% in this area of children who showed us like lower level of knowledge of mine safety rules. Also, we did the portrait how these kids this risk-taking behavior, and mostly it's like more often it's boys aged from 14 to 17 who are interested in military issues, who are playing computer games. They do not feel the reality, this line between reality, what is safe in real life and in computer games. And also very important that they visit locations that are really dangerous in their area, because like forest in general, lakes, but especially bad thing that half of them go to destroyed buildings and walking there, and 1/3 of them goes to abandoned military positions. Also, it's more frequently children from rural area and low income families. So these were those like target groups that we showed the UNICEF and State Emergency Service that they need to work more with that. Also, we're comparing awareness and behavior. Like awareness is like, I know that the mines and explosive ordnance can be there, but still some of them, they visit this place and they spend time in this place. In general, the good thing we found that children mostly they can identify the hazardous objects. They know that it's unsafe. Also, thanks to our methodology, like we in our data set, we have answer of the parent, answer of the child. We can compare the results. And for example, we found that children knows better some things than their parents. For example, the right number to call when they see explosive ordnance. Also, important for politics and policies is the sources of information. The good thing that mostly they receive some information, and if they received any information, is better when they don't receive it. But like the most better like influence was like cartoons, for example, for younger children, and the worst results were among those who do not receive any information at all. The last one is the problem. What we found is, for example, about marking signs. When we have a sign and a tape together, the children can recognize that it's dangerous. When we have only sign, children can recognize it. But when we have only tape, like red and white tape, we found the problem that half of children do not think that it is something dangerous in context of explosive ordnance. So that's something very important that state emergency services, they start working on it for better marking the place and like getting better knowledge of awareness, how these tapes and ribbons look like. On the last few slides, that was not... that was like more our recent research on mental health. So I want to talk about methodology. We had the same methodology, firstly recruiting parents and then asking children some questions. It's more experimental study. We think that we need to expand it because it's really sensitive topic and it's not a question of 1 month. It will be much longer. But what the difference is that here we are comparing different groups, like also youth, adults, children, and different gender, because it was important for UNICEF and other institutions to see these social demographic groups. So we aim to determine the level of psychological resilience, that assess their attitudes toward mental health support, and they work on this start just long before the field work, because we needed to have reliable Ukrainian adapted instruments to measure loyalty, for example, to psychological support stress level. We did 2 stages of pretest of this methodologist, and our professor, doctor of psychology, Maranat College, who is lead of our laboratory, they were doing the validation both for children and adults separately to try to measure these things. So, for example, our laboratory built the loyalty scale for seeking mental health support, and here are the results, what we found. We analyzed children and youth, as I said, and also the gender gap, and we see that in all ages, no matter what the age is, women are more likely to be open to psychological care than men. But also we have some age differences. For example, if we're talking about children, in younger age, it's not that big one, but in teenage, already boys are more reluctant for psychological support, closer to the youth man, but even more reluctant. And in the older age, like after 50, 55, this index goes like even lower. So it's the group that is less loyal to receiving psychological support. We were trying to find the reasons for this disloyalty. So we outlined the most general common stereotypes and stigmas we found about psychological support. So like, for example, it's too expensive, it can be harmful, it's just a trend, it's something not for Ukrainians, like it's some modern thing that we don't need. And we even saw the correlation between people who have a bit higher progressive values, who are more tolerant, they are also usually tend to be more open to psychological assistance. We used also the autonomy scale from World Values Survey when on individual heart and values traditional and secular values. So we see that it is also about the values, like perceiving the psychological support, about the more progressive and postmodern values, and appraising imagination and determination, independence for child. If parents saying that I want to raise obedience and religiosity, they tend to be less loyal to the psychological support for their kids. Also, we had practical questions. For example, among those kids who were visiting psychologists, almost half of them visited private, and another 40% visited school-free psychologists, and we were comparing these experiences, finding that in general, the indicators we built with what means effectiveness is more subjective assessment, and some criteria based on image gap index are better for private psychologists than for school psychologists, especially if we're talking about the comfortable, how comfortable do they feel during the session. That was a big difference between private and school psychologists. And in the end, finally, I would repeat that it's more experimental study, because we will dig in more, and we will try to define some more definite conclusions. But overall, we tried based on adaptation scale, adaptation scale to perceived stress scale and psychological resilience, try to find more vulnerable group who may need the help right now. It was important for UNICEF and our local government also. So the most first things we just see, and it's more hypothesis to test further. For example, that the most vulnerable children are those who have parent at the front line, mostly their father, who is serving on the armed forces of Ukraine. So they have really lower level of resilience they may have, yes. Also, there's the question about talking with parents. Those who talk with parents more often, they show us a bit better ability to cope with stress. Yes, but it also has a gender difference. For example, for girls, it seems to be like more important than for daughters than sons. And so these were just general results that hints that we want to show our partners and like ourselves to investigate further. And we hope that we will succeed and explore these topics in greater depth. I think it's the most general things I wanted to show you about how it's working and how we do this. And I will be glad to see that my contacts if you need. I will be glad if I'll hear a question from you. Thank you.
I find myself wanting to apologize to you, our audience. I was so concerned that we would go too long. Then myself and my colleagues went pretty fast. The outside of that is now we have plenty of time for discussion, and we want to take time for discussion because while we wanted to show you our work, we also very much wanted to hear from you about what your questions were and what topics we could address. So please, I invite the questions.
How long have you been doing this? And what was the last time when you met? Do you have any file numbers?
Yes. We are based in Kyiv. We are working in Kyiv, and I came here from Kyiv. So in like less than months, I will travel back to Ukraine. We are doing all our research from Ukraine. Like except we have a small group of interviewers in Poland, Czech Republic, Germany, but it's really small. Mostly we are already from Ukraine. So I have all my family members at the Ukraine. And I also will get back there in the summer, and I will stay there. So, like, it is really more easier to see the context when you are there. Right now, I experience some problems communicating with my colleagues because we have a big style difference. But generally, yes, we do a lot of communication. As for the research, if we're talking about field work, it takes like up to 1 month if we're talking about weak samples, but we need like 1-2 months to prepare before, because if we have a pre-test, we have validation periods, so we need more time. And preparing report, for example, for mine safety took us also 2 months because there were too many information and a lot of questions. Making reporters for each of the small districts, that takes about 2 months. In general, we started in March, for example, for mine safety, and we finished in June when we presented for Ministry of Internal Affairs and presented the results.
Let me say how much I appreciate that question. Seth and I felt very fortunate that Tetiana was able to visit Salzburg, and we were able to meet at that conference. I have a few friends from Nepal here. I worked my whole career in Nepal. I will never do a study in a country where I have not lived, and this is my first time. And I think Stephanie and I both appreciate not just Tetiana's expertise, but the commitment of this organization to remaining in Kyiv, doing studies all over the region of the most difficult topics they face. In that context, we felt like if we could partner with Tetiana and the organization she represents, we could do an actual sincere job of studying it from the Ukrainian perspective. So I really appreciate that question.
And we did it pilot quite fast because it was a smaller sample. So we completed in 1 week in March, and we did 1 more week in April.
Yeah, they're able to execute very quick, but I will also say able to take our questionnaire ideas and get them not just translated, but thoughtfully to the local context considered. We just think if we were able a lot every time we're designing a questionnaire for some other language, culture, setting, situation, includes a very complex situation.
First, I want to thank Tetiana here and study this research aspect next to my neck is for I'm by session and the other 7 I'm from Kyiv too. So, and my last visit was 3 weeks ago. I came back from Kiev. So I have one practical question about the result that you showed. You showed that, like, you had two samples, one the national sample, right, random national sample, and another was you specifically targeted the contaminated areas, right? And how did you weight your analysis? Is it weighted analysis that you've shown us? How do you account for these two different samples?
Yes, thank you for the question. Mostly we did analysis in one contaminated areas, and it's almost all the results I showed you more in one contaminated areas. When we have figures like general, yes, we are weighting them because we had a larger sample we created general, and we needed to cut much more this area to show results in general. I didn't show results in general because mostly we were interested in contaminated areas. We have our full report, which is like more than 100 pages. You can see that. And where we have Ukrainian number, it means they are weighted. They are weighted based on the region people live.
Yeah.
Or lived before the war, like on 20 till 22, or live now. So they were weighted according to latest statistic we have, and latest statistic is 2022.
Thank you.
But it speaks to a general issue, of course, in a time of violence. There's a lot of physical movement, and we're using these methods for our pilot that Stephanie mentioned, where we're trying to use phones and cell towers and internet in any way we can get a sample. We don't actually know how to weight it back to a baseline in that situation. And in some, I'm a demographer, so I'm very obsessed with being population representative. And I've kind of set that aside a little bit for this because I feel like it's more important to follow these kids and learn what we can about their trajectory over time. But it's going to be in the background of all these issues because it'll be very hard in any sample we take now to weight it back to the original. I mean, we're fortunate, actually. Rating Group we replicated measures from studies they had done before the war began for example, UNICEF, that we could use the same measure to try and get a sense of how, but, it's tough.
Yeah, we have lost census in 2000, I think, yeah, in Ukraine. So, we don't have reliable statistical data, unfortunately. Yeah. And when we were doing these contaminated areas, it was really hard to reach people there because no one knows exact number, how many children stayed today there. So, yeah, it's tough. Sometimes our probability-based telephone survey showed much better statistic because it's more random people who really living right there now, and it differs a lot from the statistics we have from state. Yeah.
It's definitely very challenging from the practical point of view and from methodological point of view, because it's a lot of migration and everything. Yeah. Will you have a chance to follow up with these children? Or is it one?
So, yeah. So, welcome to the Institute for Social Research. I think you may have some background here. We write proposals for funding to do studies every day. And we were working on that yesterday. After we finish here, we'll go back upstairs and work on that more. But I think we consented the pilot sample to be able to interview them in a year, if nothing else, to try that. In the meantime, we have a proposal that NIH reviewed and did discuss and score. I would be very surprised if that one results in us being able to launch, but we don't have the reviews back yet, so we're not even able to judge that very well.
Good luck.
Thank you. And we welcome anybody's help. Yeah.
And I don't want to usurp the mic, but I have a question to the first presenter. Yeah. I'm sorry I didn't catch your name, Stephanie. So, when you showed results for the mental health, from parents from both Poland and Ukraine. So, but people migrate back and forth, right? It's not stable, because a lot of Ukrainians, just the latest survey that I've seen in the press today, that many people who stay abroad in Poland in particular, they consider to come back to Ukraine. They're thinking about it. So it would be very interesting to see how the perception of people change going from one part of the sentence.
So for our pilots, I don't think we had anybody who's one person. So for our pilot sample, all of the respondents, both at baseline and the re-interview, either had stayed in Ukraine or had stayed in Poland. So we didn't have that across-country migration during the period of the pilot state. But that's exactly why, as we're defining the larger scope, when we go back in 1 year, 2 years, 3 years, we do expect that there will be more, cross-country migration, not just within country mobility, and then we can look exactly at the impact of that.
And Emily Trillo, who did the introduction, is collaborating with us on this, in part because she has expertise in child health, and any of us combined probably. But also because she studies the relationship between migration and child health. And we do believe that will have consequences that will be complicated to understand.
Thank you very much.
Of course.
I think your presentation, I also kind of similar to Ian's question, but different. And maybe I was sitting here that this is the beginning, so I was a little bit late. But I was wondering, I was listening to Stephanie and Tetiana, your presentations. I mean, there's a lot of data, so I don't know which ones to pick on, but I was wondering, with some of the disaggregated data, you're thinking of it as people living in Poland, people living in Ukraine, and I'm just wondering if there is an element of the issue of internal migration or internal displacement, if you're seeing those same trends that you present, there's these maybe, it's hard to say but more or less positive outcomes, what you have characterized as positive outcomes, and for people who have chosen to stay in Ukraine or have stayed in Ukraine. And I'm wondering if those same trends hold up if there's internal migration for Ukraine, because if it's more about being in Ukraine or not having been displaced. And then also if you're thinking to expand it beyond Poland, because Poland and Ukraine, as Irina mentioned, people can travel back and forth to the border. There's some, it's close in some ways.
Sarah's really far. Sorry, our sample numbers for the pilot were too small, but we did. For the respondents living in Ukraine, we still asked them, at a fairly detailed level, like 24, 27 districts, where did you live, prior to the start of the invasions, and where do you live now? So we do have a measure of that internal mobility, even within the Ukrainian sample. Yeah. Right, but here numbers are the number of respondents, who moved and are in each of these districts, I think it'd be hard to do any meaningful analysis, but we definitely would include that same, those same points of data collection in a larger study. And we are definitely planning on expanding the look at refugees beyond Poland. And we're in discussions right now on what makes sense. What are kind of meaningful groupings of, locations for the refugees. And right now, you're based on Tetiana's advice, knowing exactly, what's happening right now. We're thinking of kind of a regional grouping of families who have gone to Eastern Europe, so Poland, Czech Republic, Slovakia, and families who have gone to Western Europe, which is primarily Germany, but a few other countries. And then we can see, what mobility is there across those regions and what differences are we seeing in child health outcomes based on where these families ended up. So as a part of the larger study.
In fact, the proposal I mentioned earlier that was reviewed already, that was to scale up to a 1-year goal with more than 1,000 in each of Ukraine, Poland, Germany, and Czech Republic, to test a whole bunch of different methodological interventions to improve the retention across time so that we could do a better job with that before going to an even larger scale, which Stephanie just described, where we would hope to follow them for 4 full years. If NIH was good enough to give us a 5-year award, we would be delighted to do that.
That was the depth for defining caregiver. Sorry, I walked in on your presentation. Is that so it's beyond just parent, right? It's any like
Be the primary caregiver, and most of them were mothers, and especially in Poland because men of conscription age are not allowed to leave the country. So in the Poland sample, it's overwhelmingly mothers, but in the Ukraine sample, there were some fathers and some non.
Yeah, we also, I think, that's exactly you are. So it could be around a caregiver, but the one could take and make decision, the
responsibility for the child. And just one other note, because we didn't mention this since question came up earlier, for caregivers who are caregiving for multiple children, we asked them how many children they're caring for, but then we randomly selected one child using just the most recent birthday to ask more detailed follow-up questions. So we are focused on one child for each caregiver.
I have a lot more questions for the disaggregated data presented, but if you're here for a month, I can ask them later.
Well, he's not angry for the show.
Other folks with questions? Alana, here we are, saving you a minute. All yours. Thank you, everybody, for coming, and feel free to ask us any questions later, too.